We are Action for Health Initiatives, or ACHIEVE. 24 years ago, Action for Health Initiatives started with the goal of establishing an NGO for health and migration-related HIV issues. In the early 2000s, most NGOs were focused on labor rights, and there was a need to shed light on the vulnerabilities of Filipino migrant workers to HIV, especially since the first case of HIV in the Philippines was an OFW. Along the way, ACHIEVE went from conducting participatory action researches to developing and implementing evidence-based programs on HIV and AIDS, tuberculosis, migration and health, gender, sexuality, and reproductive rights, and harm reduction through the lens of community engagement, rights, and gender, or CRG. Community mobilization and system strengthening is at the core of ACHIEVE's work. We believe that in order to end HIV, AIDS, and TB, we need to let communities lead the response. Thus our tagline, Empowering Communities. ACHIEVE equips the communities with relevant knowledge and skills to engage in policy making and program development with the government and development stakeholders. When communities are empowered, they are prepared to be at the center of HIV and TB response. They can advocate for the development and implementation of people-centered policies and programs, and promote the human rights of key and vulnerable groups, particularly people living with HIV, people affected by TB, migrant workers, young people, and women. ACHIEVE helps communities amplify their voices through networking, partnership building, and facilitating linkages between and among stakeholders and communities. ACHIEVE sits as the Secretariat of Network to Stop AIDS Philippines, a national network of civil society organizations engaged in HIV and AIDS response in the Philippines, and the Philippine Alliance to Stop TB, an advocacy network of community-led and based organizations of people affected by TB in 16 out of 17 regions in the Philippines. ACHIEVE also is the Philippine focal point of APCASO in the Asia-Pacific region, a member of Coordination of Action Research on AIDS and Mobility or CARAM Asia, and the Activist Coalition on TB Asia-Pacific or ACT-AP. ACHIEVE also advocates for sustainable HIV financing through advocacy and capacity building of civil society organizations, community-led organizations, and local government units. ACHIEVE encourages LGUs to contract community organizations in delivering services to key populations. ACHIEVE helps LGUs in policy advocacy, especially in enhancing their local AIDS ordinance, ensuring that it is aligned with RA 11166 or the Philippine HIV and AIDS Policy Act, and strengthening their service delivery network for more accessible care to the PLHIV. Together with PASS TB, ACHIEVE also lobbies to policymakers for a TB law na makatao, a law promoting TB care that is free from stigma and discrimination. ACHIEVE also supports the communities in the implementation of community-led monitoring for HIV and TB. Through community-led monitoring, key populations report feedback on service quality and experiences of stigma and discrimination while accessing services. This process allows program and services to improve by ensuring that it truly serves the needs of the community. It is a long way to go to building an empowered community that will lead the HIV and TB response. ACHIEVE takes on the challenge to be better and stronger. We will continue to uphold the community agenda and protect the rights of the communities we serve. We are ACHIEVE, 24 years of empowering communities.